Let's discuss phase diagnosis, zones 2. Kidney zone. Directly beneath the temples to the line linking both the ear lobes. If this part has blood streaks, acne, or skin spots, it means that the person has a kidney deficiency or is manifesting tiredness, soreness, and pain of the back or lower back. If large, deep skin spots appear here, the person is likely to have kidney stones. If there are moles or warts, it suggests that the person suffers from a congenital deficiency of the kidney function and is manifesting soreness and pain in the back, lower back, and legs. Next, the bladder zone, the base of the nose on both sides of the philtrum. If this part is red or has blood streaks, acne, abscesses, or other imperfections, means that the person has a bladder inflammation. Associated symptoms are brownish urine, frequent urination, and soreness or pain in the lower back. When a woman has a bladder inflammation, it is usually caused by gynecological issues. However, if the base of the nose looks red, but there is no symptom of frequent urination or urgency of urination, coupled with redness of the whole bridge of the nose, this may point to rhinitis. Next, the spleen zone, the nasal tip. If this part is reddish or swollen, or the person has rhinopema, these are signs of spleen heat or the swelling of the spleen. Associated symptoms are headedness, aching cheeks, and irritability. If the nasal tip looks yellowish or pale, it points to the deficiency of the spleen, manifesting symptoms such as profuse sweat, aversion to wind, weariness of the limbs, fatigue, or loss of appetite. Next, the stomach zone. It is the sides of the nostrils. If this appears reddish, it suggests stomach fire, manifesting in such symptoms as excessive hunger and bad breath. If blood streaks become pervasive, it warns the possibility of gastritis. If they look bluish-gray, it indicates stomach coldness. If they appear blue and withered, accompanied by a constant prolonged stomach ache, means the person has atrophic gastritis. If the sides of the nostrils are thin with deep furrows, it could suggest atrophic gastritis. Next, the small intestine zone, beneath the cheekbones on the medial side. If this part has red streaks, acne, skin spots, moles, or warts, it indicates poor small intestinal absorption, causing the person to look physically thin and weak. Next, the large intestine zone, beneath the cheekbones on the lateral side. If this part has blood streaks, acne, skin spots, moles, or warts, it is indication of defecation dysfunctions of the large intestine, and the person tends to experience dry stool, constipation, or loose stool. If this part has crescent-shaped skin spots, it means the person is susceptible to constipation or has hemorrhoids. Next, the reproductive system zone, the philtrum and around the lips. If a female has moles or warts below the lips and her chin looks reddish, but the kidney zone is smooth and clean, it usually indicates that this person experiences soreness and pain on the lower back. If a female has moles or warts around her lips, or the area surrounding her lips appears bluish, black, or pale, accompanied by abnormalities in the kidney zone, it often means that the person is rigid. If a woman has a mole in the philtrum, it points to problems with the uterus. If a man has a mole or warts above his lips with abnormalities in the kidney zone, it suggests problems with his reproductive system. If a male in his 40s and above has a thicker upper lip, that means he may have an enlarged prostate. If he has a recurrent acne on his lips, it means that he has prostatitis. A man whose upper lip is not smooth and has furrows on it may have problems of sexual dysfunction. Thank you for your attention.